Ozempic is advertised as a weight loss drug, and it is, but doctors say it's not right for everyone.
And that's where there is concern tonight. As Jason Colthorpe reports, people who can get it, or who can't get it rather, are opting for dangerous alternatives elsewhere.
Yeah, very dangerous. In fact, one of these popular alternatives isn't even meant for humans.
Well, I've been diabetic for about 10 years now.
Terry Gottschall is one of so many people who have had that scary talk with their doctor where they're told they have to change their life.
You're kind of in shock when you get told that. Looked at me and said, well, frankly, you need to lose about 100 pounds.
Well, Terry got to work. 2.5 years ago, though, she'd hit a weight loss wall, and her doctor recommended Ozempic. And the results were
wonderful. It has taken away a lot of my appetite. I am down 120 pounds. Not all of that was because of Ozempic. I had lost about 80, 90 pounds before I went on the Ozempic.
I have been using Ozempic in my practice in obesity medicine for about 2 years now.
Dr. Suki Singh calls Ozempic a fairly safe weight loss medication that comes with some nauseous side effects.
What's important is you pair this medication with the right lifestyle and eating habits.
But it's not Ozempic that concerns her. It's a couple of other drugs billed as weight loss lifesavers that are gaining popularity on TikTok. The first, a supplement that's been around for years called berberine.
It is a supplement that is known to help with some metabolic functioning, especially the heart. However, it's not FDA approved. There's really no data available for humans. Anything that's available is based off of animal studies.
And that's right. It's a drug for animals. And not only that, Dr. Singh says it offers almost no weight loss.
It is dangerous because there's animal studies showing side effects of an enlarged liver, kidney issues, as well as a lower blood count, which can affect your ability to fight infections.
The other fad revolves around the generic version of Ozempic, semaglutide. Terry saw an ad for it on Facebook.
I see a Groupon ad, and there's a picture, semaglutide, which is the generic name for Ozempic, available at a discount through Groupon. But it pictured a vial in a syringe, and I thought, that's not how Ozempic comes. What is a patient really getting if they order this?
It's gaining popularity with celebrities and at med spas and boutiques that offer cosmetic procedures like Botox.
Taking this medication, selling it at a much lower cost to patients, but in reality, they're making a lot of money off of this stuff, which it's the safety of patients and doing blood work, and all of these things are not being done.
Dr. Singh told me many times during this interview, obesity is such a complex disease. If you're looking for treatment, you have to go to reliable resources for those treatments, and things like TikTok and Facebook and the like, not it. I'm Jason Colthorpe, Local 4.
Hey, Jason, Dr. Singh, by the way, is with Henry Ford Health. She notes that Ozempic is approved for obesity treatment, most often in patients with a BMI, a body mass index of 27 or higher, and with a chronic condition that would benefit from weight loss. Those would include diabetes, high blood pressure, high cholesterol, and sleep apnea.